So I'm Gary Puckrin. I'm president of the National Minority Quality Forum. We are a research and education group based here in Washington, D.C., and I'm here today to talk to you about National Minority Health Month. So back in the 1980s, 1984, I believe to be exact, um, Margaret Heckler, who was uh, Secretary of Health and Human Services, issued a report that documented the existence of health disparities. Before that report from the federal government, there was some disagreement about whether health disparities actually existed. And so, with that documentation in the 1990s, with J.C. Watts, Republican from Oklahoma, and Congresswoman Donna Christensen from the Virgin Islands. We worked with them to pass a resolution establishing April as National Minority Health Month. So why did we do that? We did that because with a congressional resolution, federal agencies could now celebrate April as National Minority Health Month, which meant that they could do programs. Department of Defense, Department of Education, Health and Human Services, et cetera, could launch programs, and they did, to talk about the disparities in healthcare, to educate about how to improve them, to give guidance to individuals and other organizations about these inequities. And also, what it did was it created what we would call a pacing event. It meant that before you got to April, you had to do programs in November or December leading up to April that would educate people about those disparities. So it was incredibly important opportunity, and it also bled out to the states. About 25 states, seeing that the federal government had acknowledged April as National Minority Health Month, began to do programs in their state for the disparities and programs like that. Ohio did a lot of great work, presented grants to organizations, etc. We continue to celebrate April as National Minority Health Month, but now for even bigger reasons. And that bigger reason is what we've come to appreciate over all this work in trying to improve healthcare for all of Americans, that there are natural laws that essentially control our biology, our heart, our kidneys, the way we metabolize food, the blood circulating in our body. All we don't control them; they're all controlled by a set of rules and laws. And that what healthcare is trying to do is to optimize those rules and laws, and certainly to keep them from what we would call disorder or disease is probably the more common way of referring to them. That breakdown in order in our biology is a consequence of changes in those processes, in those natural laws that bring on illness. And what we've also come to learn is that our healthcare system is actually an extension of our biology. And what I mean by that is if you have disorder or disparities in the delivery of healthcare, that chaos and disorder will manifest itself in biological systems, in hospitalizations, emergency room visits, disability, mortality, and poor quality of life. So National Minority Health Month has sort of evolved from the place where it was, taking up where Margaret Heckler started the process by recognizing disparities in healthcare, to a place now where what we're trying to do is optimize care for everyone. Homeostasis is what it's called, is the scientific word for it, in which we are looking at those biological processes and trying to understand how do we keep them in good order? How do we make sure that everyone lives long, high quality, long lives? And that's what we're celebrating in April. That's the history of National Minority Health Month, and that's what we're trying to do today with that program. So I want to thank you, and I wish you a great National Minority Health Month. and even more importantly, that I hope you join us in taking the opportunity to educate about the disparities in our country that go well beyond African Americans and Native Americans in rural communities, etc. Thank you so much.